Good evening. We are live at the Kenyatta University Teaching and Referral Hospital. Now, cancer patients have been known to seek treatment abroad due to the limited facilities that are available here in the country for cancer treatment. And tonight we'll walk you down the path of cancer diagnosis and treatment with our team of experts here at the Kenyatta University Teaching and Referral Hospital, who will walk us through the path of diagnosis and treatment facilities that are available here in the country. Joining me on set, and I'll start on this end here, is Ahmed Dagane. He is the CEO of the Kenyatta University Teaching, Referral and Research Hospital. Many thanks for joining us.
Thank you. Thank you for having me.
I'm also joined by Isaac Kamau, Director in charge of IMIC, which is the Integrated Molecular Imaging Center here at the hospital, and he is also the Director, Hospital Operations. Thank you for joining us tonight.
Thank you, Lillian, for having us.
We're also joined by Dr. Helena Musau, Clinical Oncologist and Head Department of Oncology at the Kenyatta University Teaching, Referral and Research Hospital. Many thanks for joining us, Dr.
Thank you.
And also with us is Clifflom Seum, nuclear medicine physician here at the hospital. Many thanks for joining us.
Thanks.
I'll start with you, Mr. Dagane. In terms of the PET CT scan that we've seen at the IMIS Center there, a lot of Kenyans very curious about whether it's possible to walk in and request for a scan just for your general wellness and to know whether indeed there may be any cancer cells in your body. A lot of attention over the first of its kind PET CT scan.
Thank you. Thank you, Linda. And thank you, Linda Muli. And Lillian Muli, I'm sorry.
Yeah.
And also thank you, Citizen TV, for this big conversation surrounding cancer care tonight. It's really an opportunity for many Kenyans to know about cancer management. So I really applaud Citizen TV for putting this excellent show together. Kenyatta University Teaching, Referral and Research Hospital is positioning itself to be a highly specialized facility, referral hospital, one of its kind, with highly specialized state-of-the-art equipment. And our flagship project is cancer, and so this conversation tonight is really relevant for us. A lot of things have been said regarding the facilities we have, but in short, because we are a highly specialized facility, we do not accept walk-ins for the PET CT because we are treating patients who require the services when they need. We have treated more than 10,000 patients so far, including patients from other 20 countries. We've treated 175 patients from more than 20 countries. So we have also seen an influx of cancer patients. We do treat between 800 and we do see between 800 and 1,000 patients a day.
Right.
And most of them are cancer patients.
Mm-hmm. And take us through cancer treatment options available here. What can patients that are referred here find?
We do have the Integrated Molecular Imaging Center, which is one of its kind in East and Central Africa, where we have the PET CT, we have a SPECT CT. We also have the largest cyclotron machine as well, which produces the consumables or the isotopes for the PET CTs. We do have a brachytherapy. We also have radiotherapy services through the LINAC machine. And of course, we've recently acquired the CyberKnife, which is the latest oncology specialized machine that's able to treat cancer.
Mm-hmm. Thank you for sharing that with us. Isaac, I'll come to you now in terms of advancements in technology that have been made here in terms of cancer treatment options.
Thank you, Lillian. And let me begin by acknowledging the chair of the board, Professor Olive Mugenda, who is absent today, for the enormous effort she has put in place to ensure that the institution or the hospital has an end-to-end solution for cancer treatment, diagnosis, prevention, and the whole spectrum of cancer treatment. So in terms of technology, the hospital has invested heavily through the Ministry of Health and the government. We have the PET CT, like the CEO has said. Recently, the president was here a few months ago and commissioned the CyberKnife, which is a highly specialized radiotherapy treatment equipment that is only, apart from Egypt, we are the only other African country who were brave enough to install it. Majority of patients right now lined up for that service would have been sent abroad for this service, approximately spend about 2.5 to 3 million per treatment. But the service is now locally available, fully paid by NHIF. So Kenyans don't have to worry about whether they have money to pay for the service or not.
And Dr. Helena, what is the CyberKnife commonly used in the treatment of? And even as you walk us through the CyberKnife, let's also talk about the Comprehensive Breast Cancer Center here, where you get rapid results in only a matter of days. But let's begin with the CyberKnife and what it is routinely used in the treatment of.
So the CyberKnife is a radiotherapy machine. However, it is non-invasive and it's able to deliver treatment through a robotic arm. So the linear accelerator is mounted on the robotic arm. You're also able to take imaging whilst you get the treatment to ensure that the treatment delivery is actually precise for the cancer that we're treating. You can treat different types of cancer with this machine. Anything from the brain to the spine, to the lungs, to the prostate, to the kidney, to the pancreas. So different types of malignancies can be treated with the CyberKnife, and we hope that it will be a non-invasive way to manage tumors that cannot be operated on.
And questions around whether it reduces the number of sessions that the patient would require as opposed to the other treatment options and side effects as well.
So in terms of the delivery of treatment, we're able to deliver the treatment between 1 to 5 fractions, which is 1 to 5 sessions. Unlike with the conventional linear accelerator, where we treat anything from 15 to 38 or 39 sessions. So with the CyberKnife, we can deliver treatment, a full course of treatment within a week and be done with that treatment. In terms of reducing side effects, it's quite precise on the tumor location. So it spares the normal tissues where that are not affected by the tumor, ensuring that the side effects are limited as compared to other forms of radiotherapy.
And Dr. Kiflom Sayom, in terms of testing and diagnosis, are there simple blood tests that can be done if somebody wants to check whether or not they may have any cancer cells in their body? And in terms of the Integrated Molecular Center, what have we seen in terms of the impact it has had on the populace as regards affordability of treatment as well as access to treatment?
Thank you very much for that question. So I'm a nuclear medicine physician, and to correlate your question about the blood tests for cancer screening. So normally nuclear medicine is specialty. It's literally a brand new specialty, especially in Africa. So it's all about we provide treatment and diagnosis for cancer patients and then cancerous diseases. So coming back to your question, like for example, if I specifically mention prostate cancer, so we can use simple blood tests to see the status of the disease, which is a PSA. So based on that level, we can go forward to the PET-CT scanning to assess the status of the disease. So, but like in general, what I would like to tell you about the nuclear medicine service that we provide here is, we provide so-called FDG PET-CT, which is very useful for broad cancers like lung cancer, breast cancer, like bone cancers, so like a wide form of cancers. So, and the PET-CT, the PSMA PET-CT for prostate cancer, and we do as a treatment, like investigation modalities like the SPECT-CT, which is very useful in assessing like the kidney function, the heart function, and we can also be able to assess the entire skeleton. So I will be elaborate more. So this is for now, and I will come back for details. Yeah.
Okay, many thanks for that. Remember, we are live at the Kenyatta University Teaching, Referral and Research Hospital. And this hospital here made history after performing its first non-invasive surgery using the ultra-modern cyber knife. It is a revolution here in the country, with less medical tourism, with less Kenyans traveling abroad to seek cancer treatment. A lot of facilities here will be able to take care of diagnostic needs of patients as well as treatment options for cancer patients in the country. Back to you in studio.